Good morning, everybody, and apologies for our slightly late start this morning. That's entirely down to me, none of my colleagues. And welcome to the fourth meeting of the Citizen Participation and Public Petitions Committee in 2025. We have apologies this morning from the Deputy Convener David Torrance and also from our colleague Maurice Golden, who is not with us this morning. But we do have in Maurice Golden's and David Torrance in particular, his substitute member joining us this morning, Marie McNairn. It's a pleasure to have you with us, Marie. Good morning to you. Agenda item 1 is the consideration of continued petitions. The first of these is to create an independent review of the Scottish Public Service Ombudsman. Petition colleagues may recall us discussing at some length. This was lodged by Accountability Scotland and calls on the Scottish Parliament to urge the Scottish Government to create an independent review of the SPSO in order to investigate complaints made against the SPSO, assess the quality of its work and decisions and establish whether the current legislation governing the SPCO is fit for purpose. And we last considered this petition at our meeting on the 15th of May 2024. It doesn't actually feel as long ago as that. I can remember the conversation quite vividly, when we agreed to write to the Scottish Government and the Scottish Parliament Finance and Public Administration Committee. Now, the Scottish Government has reiterated its view that an independent review of the SPSO, including a review of the 2002 Act, is not required. Colleagues may recall this is all in relation to the fact that it's been in existence for 20 years and no review has ever actually taken place. The submission highlights the evolution of the SPSO's functions and scope since its inception, stating that its powers and responsibilities have not remained static. The Scottish Government also highlight the existing accountability and scrutiny functions. The submission reiterates that the Scottish Government does not have the available resources or capacity to initiate and take forward an independent review due to the existing commitments and competing legislative priorities. Now, the petition's written submission of February last year called for Accountability Scotland to present oral evidence on what an independent review should consist of. Since then, the Local Government Housing and Planning Committee they held a call for views on the Scottish Public Services Ombudsman and took oral evidence from Accountability Scotland alongside other stakeholders. So that opportunity has been afforded. The Local Government Housing and Planning Committee also took evidence from the SPSO, and in our evidence to the committee, the Ombudsman shared options for how an independent external review could operate. She stated that a review would be attractive but noted the costs involved and the importance of defining the remit and outcomes from any such review. The Local Government Housing and Planning Committee has subsequently written to the Ombudsman to share its observations, and the committee's correspondence raised a number of points, including a lack of available performance data, levels of customer satisfaction, neutrality in external evaluation. And it also highlighted the SPSO's suggestion that it may be time to reflect on the way the Scottish public scrutinises the SPSO and proposed that the Finance and Public Administration Committee could have a larger role in scrutinising the accountable officer. So since this petition was last considered, the SPCB Supported Bodies Landscape Review Committee was established, and it also took evidence from the SPSO in February this year. Its role is to review and develop a framework for SPC-supported bodies, and it's expected to sit until the 30th of September this year. And in the light of that, colleagues, I wonder if Fergus Ewing.
Yes, thank you for that very full exposition of what has happened since this petition was published on the 7th of September 22, nearly 2.5 years ago, and there has been this, as you have described, a fairly detailed consideration by this committee and other committees as a result of Accountability Scotland bringing this issue to Parliament. So there has been a good airing of many of the issues involved. I have a lot of sympathy with the petitioners, but I would suggest, Convener, that in the light of everything that you've said, in particular that the Local Government Housing and Planning Committee recently held a call for views and took evidence to consider the performance of the Ombudsman and how this is evaluated and improved, and also that, as you say, the SPCB Supported Bodies Landscape Review Committee has been established to review and develop a framework for SPC supported bodies that I think we have ensured this petition has been properly scrutinised by Parliament. I would just add that having looked at the 2002 Act, in particular Section 16, the Act provides, as I alluded to in the evidence session, I think last September, that there's no power of the Ombudsman to award any specific remedy to any individual, despite the fact that it has got the power under Section 16 to issue special reports where there has been a quote, sustained injustice or hardship, but it doesn't then have any power to recommend that the body that caused the harm should issue any compensation. I just mention that on the record because it does seem to me to be a lacuna, and to be fair, if somebody goes to the SPC, Scottish Public Services Ombudsman, seeking injustice, and all they get is, well, your complaint is upheld, they may well feel that that is unsatisfactory in the most serious of cases where there has been injustice and hardship. So whereas I think we should close the petition, I do hope that, and I expect that the supported bodies committee might be asked to consider this matter along with the rest of its consideration.
Okay, I'm grateful to Mr Ewing. Are colleagues content on this occasion that we close this petition? We are. Thank you very much. And for the reasons Mr Ewing has stated. Petition number 2006 is to review and simplify the legislation in relation to dismissal of property factors lodged by Ewan Miller. This petition calls on Scottish Parliament to urge the Scottish Government to amend the Property Factors Scotland Act to cover dismissal of property factors or bring forward other regulations that would achieve the same aim. And this could include giving the first-tier tribunal powers to resolve disputes related to the dismissal of property factors. Now, we last considered this petition at our previous meeting on the 19th of February, colleagues will recall, when we heard evidence from the Minister for Victims and Community Safety and a number of Scottish Government officials. And during that session, we heard that the Government plans to publish guidance aimed at helping homeowners to navigate the various options for how voting procedures should be carried out when dealing with factors. Now, the Minister also expressed a willingness to consider new suggestions on how the process to dismiss a factor could be simplified, including a suggestion from our colleague Fergus Ewing on whether the Small Claims Court could be empowered to determine and dismiss property factors in cases where the factor is considered to have overcharged residents. Now, we also heard that the Government is considering the recommendations of the Competition and Market Authority's report into house building, with the Minister indicating that her colleague, the Minister for Housing, may be exploring some of these issues in a proposed roundtable with property factors. And having had the opportunity to reflect on the evidence we heard last meeting, do members have any comments or suggestions for action? Because I think probably we'll want to formalise the suggestion from you, Mr Ewing, if you'd like just to suggest that formally.
Well, thank you. I was going to suggest that we should write to the Minister for Victims and Community Safety to ask what further consideration the Scottish Government has given to the suggestion that the Small Claims Court be given powers to dismiss property factors, but in those situations where excessive charges have been introduced. And that matter arose in evidence that Sarah Boyack presented to the committee some time ago, which indicated a particularly egregious example of apparent overcharging, but also seeking further detail on the Scottish Government's response to the Competition and Markets Authority report into house building, including the anticipated timescale for the responses to be published, and to ask how many property factors have been dismissed in the past 10 years, although I'm not sure the Scottish Government will have that information.
No, I have a slight recollection that they said they didn't have that information, but I think it might therefore be useful in asking that question to ask if this information doesn't exist, then how might it, or isn't currently compiled, then how might it be established?
Yes, quite so. I'm just going to add that I did think the Minister was very open to suggestions in her evidence. The demeanour and tone of her evidence was encouraging in that regard. Yeah. So I wanted to place that in the record, but also just express some concerns that guidance alone is unlikely to appease those who have a real grievance, but also finally just make a point, Convener, that from my own experience as a solicitor for quite a long time, that most property factors are fairly diligent, and certainly in the course of dealing with working tenements, they very often have difficult situations to deal with, where owners are at loggerheads, and where the level of fees charged are actually not, in my experience, particularly huge. So I just wanted to make it clear that I don't think this committee is in any way suggesting that, that all property factors should be criticised. Quite the contrary, they've got a difficult and sometimes thankless job to do, a necessary one for repairs to common property, because otherwise that would not happen. So I thought it was only fair to put that in the record. But where there's excessive overcharging, I don't think the law has got any real remedy other than going to court, which is so expensive that nobody will ever really take it up unless you're a multimillionaire, in which you probably don't live in a flat in Govanhill Street if you're a multimillionaire anyway. So there we are.
No, thank you very much, Mr. Ewing. I think that's absolutely correct. That we should just make clear that the committee is not, in supporting the aims of this petition, identifying all property factors as villains. Far from it. Many I know from my own constituency have expressed that they're perfectly satisfied with the service that they receive and believe that the property factors act very much in the interests of residents. But where there is an issue, I think there is a lack of remedy. I wonder if we might also write to the Law Society of Scotland just to seek its views on the suggestion that the Small Claims Court be given powers to dismiss property factors in those situations that Mr Ewing has described, where excessive charges have been introduced. Are the committee content? We are, thank you. Petition 2033 to introduce a full ban on disposable vapes, lodged by Jordan Anderson. And it calls on the Scottish Parliament to urge the Scottish Government to legislate for a full or partial ban on disposable vapes across Scotland, and to recognise the dangers that these devices pose to both the environment and the health of young people. And we last considered this petition on the 17th of April last year, when we agreed to keep the petition open until such times as regulations to ban the use of single-use vapes were introduced, or at least until we had a clear indication of when they would be introduced. Now, as members will be aware, Parliament voted to approve the Environmental Protection Single-Use Vape Scotland regulations in September last year, with the regulations expected to come into effect on the 1st of April this year. However, commencement is now expected to take place a little later, on the 1st of June, the intention being that this will ensure alignment with similar regulations which are now being introduced across all 4 nations of the United Kingdom. We've also received a submission from our MSP colleague Maggie Chapman, who commends the petitioner, Jordan, and others for their work on this issue and calls on us to keep this petition open until the regulations are in force. But I don't know what colleagues might feel about that. Mr Ewing?
Well, as it happens, Convener, just on Monday this week, I had an informal meeting with someone involved in the grocery business in Scotland, where he expressed a number of concerns that the proposed ban, which is welcome, won't actually go far enough because it doesn't prevent the importation of vapes. They will therefore continue to be imported. They will continue to be sold. They will be sold in the black market. He said they already are being sold in such manner, and they have been sold in an unauthorised way by various groceries. And in particular, there are no penalties enforced for other than recovery of tax in respect of the particular number of vapes identified as having, which are identified as wrongly sold. So I'm no expert in this, but I do find myself somewhat unusually agreeing with the Green MSP that perhaps there is more that might be done in addition to what has already been done, because the illegal vapes that are being sold are very often injurious to health, so I'm told. I'm just going to suggest, Convener, that before we close this petition, and it may well be that that's what we do later, we write to the Scottish Grocers Federation, who represent over 5,000 small convenience stores and employ over 50,000 people, and therefore probably the people on the front line who are dealing with the sale of vapes, and who are under huge pressure through physical attacks on their members of staff, incidentally, often associated with the sale of such items, to ask for their views as to whether or not this ban will go far enough, because I do actually agree with Maggie Chapman that this is a matter of profound concern. And, you know, we've taken all sorts of action about smoking, and vapes to many people are just smoking by the back door.
Okay, well, hell must have frozen over. I never thought I'd live to see the day. But in view of your paean of praise to your Green colleague Maggie Chapman, Mr Ewing, calling for this petition to remain open, I think you make an important point. I think the Scottish Grocers Federation we could write to. I mean, is it too early to draw this? Because I suppose this is anecdotal at the moment to the Scottish Government. Maybe better just first off see whether we get something more formal from the Scottish Grocers Federation. Yeah. Are there any other suggestions? Are we content to keep the petition open on that basis, and to so advise, I think, Maggie Chapman, that on the motion of Mr Ewing, the petition has been kept open for that reason? Okay, we move now to petition number 2067 to improve data on young people affected by conditions causing sudden cardiac death. And this petition is lodged by Sharon Duncan, and I believe, is that Sharon Duncan, because my eyesight's so faulty these days, but I believe we have Sharon Duncan in the gallery, so a very good morning to you. The petition calls on the Scottish Parliament to urge the Scottish Government to commission research to establish how many people aged 14 to 35 are affected by conditions that cause young sudden cardiac death, clarify the number of people who die annually in Scotland from these conditions, and set up a pilot study to establish if voluntary screening can reduce deaths. Now, I know that we very much hoped to be joined by Oliver Mundell this morning. Unfortunately, Oliver Mundell is unwell and hasn't been able to attend Parliament this week, so he has sent in his apologies. But we last considered the petition at our meeting on the 20th of March last year, when we agreed to write to a number of organisations with a view to better understanding what research may be underway, as well as inviting views on the call for a pilot study for a voluntary screening programme. And copies of all the responses we've received have been included in our papers for today's meeting. Now, the response from Cardiac Risk in the Young, CRI, provides detail in calculating and understanding the incidence of conditions associated with young sudden cardiac death, and suggests inaccuracies in the way this is recorded by the Office of National Statistics, which has led to UK and Scottish governments underestimating the impact these conditions have on families and society at large, which is clearly disturbing. Similarly, the British Heart Foundation and Chest, Heart and Stroke Scotland both highlight the importance of research for improving understanding of the prevalence of sudden cardiac death and how best to identify the risks associated with it. Both organisations indicated support for further research, with Chest, Heart and Stroke Scotland believing that if the Scottish Government commissioned research, including a pilot study on voluntary screening, it could, and I quote, provide crucial insight and offer a valuable contribution to the current evidence base. Now, we've also received a response from the Minister for Public Health setting out how the Scottish Government and other UK nations engage with the work of the UK National Screening Committee, noting that governments cannot tell the National Screening Committee what issues it should consider review. However, the UK National Screening Committee stated in its response, dated May last, that it is not aware of any significant new work on whole population screening which would suggest a different outcome to their previous review in 2019. But it does plan to review evidence relating to population screening for sudden cardiac death within the next 3 years. And the response also notes that the NSC's terms of reference have been expanded to include consideration of targeted or stratified screening programmes, and while it has not yet been asked to consider targeted or stratified screening for sudden cardiac death, it can be alerted to any new published peer review evidence which may suggest the case for a new screening programme. So we have also received 2 submissions from the petitioner. The petitioner welcomes the responses from CRI, Chest, Heart and Stroke Scotland and the British Heart Foundation, and draws our attention to discussions that have taken place elsewhere in the UK, including an event at the Italian Embassy in London, exploring the mandatory screening programme for young people involved in organised sport in Italy, and how this programme might be adapted for use in the UK. Ms Duncan, who shares information on the meeting she then had with the First Minister Humza Yousaf, the then First Minister Humza Yousaf, and the Cabinet Secretary for Health and Social Care to discuss the possibility of commissioning or supporting research into the impact of diseases leading to sudden cardiac death in Scotland. So, quite a bit of progress, but I think still work to do, and I wonder if colleagues have any suggestions for action. Faisal Chowdhury.
Thank you very much. I think we should keep this petition open and write to the Cabinet Secretary for Health and Social Care to highlight the evidence the committee has received and seek an update on discussion that Cabinet Secretary has had with the Chief Scientific Officer about commissioning or supporting research into the impact of disease leading to sudden cardiac death in Scotland. Also to ask what consideration the Scottish Government has given to the commissioning a pilot study on voluntary screening, including details of engagement it has had with organisations such as British Heart Foundation, Cardiac Risk in the Young and Chest, Heart and Stroke Scotland on this particular ask of the petition. Also, I think, given what the petitioner highlighted in their submission regarding the Italian screening programme, I wonder if the Italian embassy or consulate would be able to provide a briefing or research in relation to their screening programme, reducing SCD by almost 90%.
I think that's a very welcome suggestion as well. I was, I have to say, unaware of the programme in Italy, so I think that would be useful to have some further information on. Obviously, this is an issue in a petition which has resonance for all of us here in Parliament, given the loss of one of our staffing colleagues. Mr Ewing.
Yes, I agree with that recommendation, and note that Mr Mandel has been pursuing this doggedly and with feeling since the outset, and that there is, I think, a very serious issue that just hasn't, to me, been resolved, although I'm no expert, and the Minister for Public Health has provided a fairly lengthy reply, unlike some cases, so that is good. But on the one hand, the petitioner argued initially that I think it was 12 preventable deaths per week, and quite a kind of high incidence, but the National Screening Committee kind of argues precisely the opposite. I did note that in the Minister's response of the 21st April 2024, that, and I quote, the error or misunderstanding of the incidence of YSCD is why we have made repeated requests to meet with the National Screening Committee to clarify this issue. We have also requested NSC transparently publish the pre-screening and post-screening incident death rates for the other conditions which meet the NSC screening criteria. I wonder if we've quite got to the bottom of that, and if, when we're writing to the Cabinet Secretary, we could specifically ask whether that meeting has taken place with the National Screening Committee, what they say, what their updated position is, and why, and what is the explanation for the apparent massive discrepancy between the two positions. If the petitioner is right, then the problem is profoundly serious, not only for her and her tragic loss, but for many, many families across Scotland and indeed the UK. And therefore, I think we've got a duty to ensure that the Minister's efforts are assisted by this committee so that we get to the bottom of this if we possibly can.
Thank you, Mr Ewing. I mean, I think obviously that just because of the scheduling of this petition, we end up considering it almost as we come round to the anniversary of David Hill's death, Sharon Duncan's son, which of course was on the 19th of March in 2022. And I would just like to thank all those colleagues and also the Scottish Rugby Union for the work that they do in keeping David's memory alive, and the work that Parliament and others do to bring attention and feeling to the issue. He's still sorely missed by many of us here in the Parliament. So on the basis of those recommendations, are we content to keep the petition open and pursue the various suggestions that have been made? We are. Thank you all very much. So we'll keep the petition open and proceed on that basis. That brings us to petition number 2071. And I do apologise because it's actually quite a long narrative I've got to deliver at this point. So I'll do my best. This is to protect people from airborne infections in health and social care settings. And we last considered this petition on the 17th of April, lodged by Sally Witcher. It calls on the Scottish Parliament to urge the Scottish Government to improve air quality in health and social care settings through addressing ventilation, air filtration and sterilisation, to reintroduce routine mask wearing in those settings, particularly respiratory masks, to reintroduce routine COVID testing, to ensure staff manuals fully cover preventing airborne infection, to support ill staff to stay at home, and to provide public health information on the use of respiratory masks and the HPA air filtration against airborne infections. We were hoping this morning to be joined by our colleague Jackie Bailey, but unfortunately parliamentary business elsewhere means she is not, after all, able to join us. Now, I said a moment ago we last considered this on the 17th of April 2024, and at that point we agreed to write to the Scottish Government, the Royal College of Nursing, the Royal College of Physicians, Scottish Care, Alliance Scotland and the Care Inspectorate. And we've received responses to all of our correspondence as well as the submission from the petitioner. Members will note the volume of evidence, because it's quite considerable, that has been provided to the committee, and all of that, of course, with your meeting papers. And we asked the Scottish Government for information about its reviews of information, sources and decisions relating to the pause in or withdrawal of the COVID-19 guidance. Its response sets out that the latest review on the extended use of face masks and face coverings across health and social care settings occurred between March and April 2023. And the agreed outcome of this review was to withdraw the Scottish Government's extended guidance, and that took effect on the 16th of May 2023. On routine testing, a review was conducted in June 2023, which recommended pausing routine testing in health, social care and prison settings. And this recommendation was implemented in August 2023. A further review in March 2024 recommended ending routine testing for care home residents discharged from hospitals or hospices, with implementation expected by the summer of last year. Now, the Scottish Government's response highlights the ongoing data gathering and also the monitoring of respiratory infection levels and their impact. And the submission states that if data gathered through this routine surveillance indicated the need to consider enhanced public health mitigations, the recommendation would be offered to the Scottish Government to consider. The Royal College of Nursing highlighted its respiratory risk assessment toolkit, which aids local decision-making on the level of PPE required to protect staff whilst at work. And a number of points were raised in the written responses. These included the need to balance the rights of those receiving care with the needs of staff, concerns from vulnerable people about their safety and inclusion in decision-making about their care, staff health and well-being, and the need for capital funding to deliver improved ventilation across the NHS estate. And the response from Alliance Scotland states, and I quote, "Many vulnerable people are not reassured that the removal of protections is safe or that they are considered in decision-making. This unequal partnership in care, where people are not involved in decision-making regarding how their care is delivered, disempowers individuals and does not recognise their expertise in their own health." Now, the petitioner's written submission states that the Antimicrobial Resistance and Healthcare Associated Infections Scotland does not engage with wider stakeholders and that the Scottish ministers are nowhere to be seen. The petitioner asks, where is public accountability? She highlights that in July last year, COVID-19 infection peaked to its highest level since 2022 to demonstrate that COVID is not in a calmer phase. And the petitioner's submission also highlights a survey of nursing professionals which found that 58% of respondents would welcome more COVID-19 prevention measures in their workplaces. 40% reported having had COVID-19 in the summer of 2024. And of those, 21% had attended work while infected with the virus. And many felt pressure to come to work with COVID-19 and felt discouraged from testing themselves and patients. Lastly, the committee asked the Care Inspectorate how, and I quote, adequate and suitable ventilation is defined in practice and how it assesses and enforces the ventilation standards. And the response from the Care Inspectorate points to the Health and Social Care Standards, which includes 3 standards relating to ventilation. Standards are incorporated into the inspection methodology to ensure that they inform scrutiny and quality improvement support. The submission also explains that the Care Inspectorate expects services to ensure natural ventilation whenever possible and supports the implementation of good infection protection control practice. Where services are not operating at the expected standard, the Care Inspectorate will support improvement and can impose extra conditions of registration, serve formal improvement notices and cancel registration if an improvement service is not complied with. On the use of face masks, it is highlighted that prolonged use of face masks can inhibit communication, particularly for people living with dementia and those with communication difficulties, and can be detrimental to well-being. However, the submission states that face masks should be worn where staff think there is a risk and if the person being cared for expresses a wish for their carer to do so. So I do apologise, but we had written to quite a number of people and we had comprehensive responses, hence my need for quite a long summation. But I wonder, in the light of all I've said, if colleagues have any suggestions for action. Marie McNair.
Given the concerns raised by Alliance, I think we should write to the Cabinet Secretary for Health and Social Care to highlight Alliance's assessment that many people are not reassured that the removal of protections from COVID-19 infection is safe or that they are considered in decision-making around changes to protective measures, and ask how people with high-risk groups are involved in decision-making policies to amend and remove protections from airborne infections in health and social care settings.
Thank you very much. Mr. Chowdhury.
Can you, I'm sure, like me, our colleagues are getting emails, even from the people who's got long COVID as well. Can we ask the Cabinet Secretary for Health and Social Care to give evidence, invite her to come and give us evidence?
Yes, I think that's quite a sensible suggestion, Mr Chowdhury, which I welcome. Marie McNair?
Obviously, that's again a good suggestion, but I was thinking maybe once we get a response from the Cabinet Secretary and see what we receive, and then maybe go back and invite him. Maybe it's... Yep.
Yes, I think we could say that we'd be very... Because I think the point is we're running out of time in this session, but we also have quite a number of healthcare petitions that are before us, health-related petitions, and I think maybe we could identify a basket of those to the Cabinet Secretary with a view to us trying to just maybe take evidence across a number of fronts in order that we can actually get to a satisfactory point during this session of Parliament in relation to quite a number of the petitions that remain open. So, yes, I think that meeting might sensibly take place after the Cabinet Secretary has had an opportunity to consider the particular response that we're seeking in relation to this petition, but maybe just to flag up later in the year the opportunity to have a broader discussion with the Cabinet Secretary over a number of petitions that remain open. Mr Ewing?
Yes, I think that the idea of having a sort of conjoined session dealing with various important health petitions which are outstanding and hearing from the Cabinet Secretary on all of them is sensible. That we're doing that on transport, incidentally, with Fiona Hislop on transport issues. So that would be a good use of the committee's time, and it would save the Minister from repeated attendances as well. But I was just going to suggest that, to take up Faisal Chowdhury's suggestion, that we should, however, ask that prior to the oral evidence session, we should have received a response from the Cabinet Secretary in writing and make it clear that we would benefit from having that. As was it Marie McNair who made that suggestion?
Yes.
So we have both, in other words. First we have the written response.
Yeah.
We can then study that and that will better excuse me, inform our examination and evidence-taking session.
I mean, I suspect this session would be post the summer recess, so I think we would expect to have the information by then, but it would also allow us just to bring these various health petitions before us all, given obviously that Parliament will dissolve in a year's time, so given our rate of being able to discuss petitions, I think that would make sure that we make progress on a number of them. So we'll keep the petition open. We'll write to the Cabinet Secretary, has been suggested, with a view also to hearing evidence from the Cabinet Secretary later in the year. Are colleagues content with those proposals? We are. Petition number 2073, to ensure accurate information is used when issuing a court summons. This has been lodged by Robert MacDonald, and it calls on the Scottish Parliament to urge the Scottish Government to require the police and court services to check address information is up to date when issuing court summons, and to allow those being summoned the chance to receive a summons if their address has changed, rather than the current system of proceeding to issue a warrant for arrest. And we last considered this at our meeting on the 17th of April last, when we agreed to write to the Scottish Courts and Tribunals Service, the SCTS, and Police Scotland. As noted in our papers for today's meeting, Police Scotland declined to provide a formal response on this occasion, indicating that the Scottish Courts and Tribunals Service held the information we were requesting. Now, we have received a response from the SCTS, which notes that in cases where the accused has been released on bail, the onus is apparently on that individual or their legal representative to ensure the personal information the court has is current. An application must be submitted to the court if the accused intends to change their address. Where the accused fails to appear at a pre-conviction hearing, having been lawfully cited, the Crown Office and Procurator Fiscal Service may apply to the court for a warrant for the apprehension of the accused, and it is then a matter for the court to consider whether such warrants should be granted based on the information provided by the COPFS. The Scottish Courts Tribunal Service annually publishes an overview of the number, type and stage warrants have been issued by the courts. An extract of this report was in fact included with our papers, and in view of that direction, do members have any comments or suggestions as to how we might proceed? Colleagues, any thoughts? Mr Ewing.
Yes. Just going back to the original petition lodged by Mr MacDonald, the background was that to this petition is a little bit alarming, and it's worth stating, just for the sake of the petitioner, that on Saturday, the 4th November 2023, Police Scotland attempted to arrest a paramedic at home due to missing a court date. The summons had been sent to a previous address, and thus the paramedic had no knowledge of it. On the evening of 6 November, the individual was arrested and spent the night in the cells. The summons was for a court date in 2018. So more than, well, around 5 years. So after the original summons. So I'm kind of concerned that we haven't really had a proper explanation for that. And I would just add, Convener, though I won't mention obviously the name, but I have had a very disturbing case in the constituency of an individual who was the victim of a road traffic incident where information about a court diet was mistakenly sent to the accused person and not to him, and for which no full explanation has ever been provided. So I'm not sure that this is just a one-off, and I wonder if we could just reflect on whether we do, out of fairness to the individual involved here in this petition, need to just give a little bit more thought to try to get to the bottom of this. It's not clear to me what the status of the paramedic was, nor whether the required explanation that you've said should have been provided according to the public authority involved, namely that the onus is on the individual to inform of a change of address. It's not clear to me whether that's applicable here. If it is applicable, then I guess the point probably does apply. But if it's not applicable, then we haven't had an answer to the petitioner, and the petitioner hasn't had a proper hearing. So I wonder if we could perhaps just give some careful thought, in case I've got any of the detail of this wrong, Convener, in which case I would sincerely apologise to the committee for wasting time. But this man was put in a cell in circumstances which seem to me to indicate some possible fault on the part of the state. We cannot allow that to happen.
So what might we do, Mr. Ewan, do you think?
Well, one option, as I'm doing the constituency case, which I've described, is to compile a letter to the Lord Advocate and seek her view as the person in overall charge of prosecutions in Scotland.
Can you also write to Police Scotland? Because if the evidence shows that they've got the wrong address, should the person not be given a chance before the arrest has been made? Because that is totally unfair.
I mean, I note that the petitioner's previous action was to write to the regional members, and I don't know whether any of them took this up by way of either a written or an oral question to the Minister, which might have been one way of trying to accelerate a response.
Yeah, I think we should write to the Minister.
Because obviously we don't pursue an individual case, we pursue a principle on the committee.
We could also write back to the petitioner to seek a little bit more information, to ask whether the explanations provided by the public authority here, that the onus rests with the individual to inform of a change of address, is applicable here.
I suspect Police Scotland aren't going to comment on an individual case, but we could write to the Lord Advocate or to the Minister to try and establish some detail, if we could. Just to say, obviously, we've noted the wider point about the onus of responsibility being on the individual, but it not being entirely clear to us the circumstances of this particular case, and drawing it to the Minister's attention to see if they can give us some further assurance. Would that meet the committee's approval? We'll do that. Right, we'll do that. That brings us then to petition number 2084 to allow alkaline hydrolysis, lodged by Randall Graham Kilgour Fogey. The petition calls on the Scottish Parliament to urge the Scottish Government to amend the Burial and Cremation Scotland Act of 2016 to allow alkaline hydrolysis, accelerated composting and other more eco-friendly methods of disposal of human cadavers. I remember we had a fairly grisly conversation about this when we last considered it on the 15th of May, when we agreed to write to the Scottish Government Members will recall that the Scottish Government consulted on alkaline hydrolysis regulations, which found that 84% of respondents support the introduction of regulations to allow alkaline hydrolysis. The development of the regulations is currently taking place, but with no definitive date set for the regulations to be laid in Parliament. Do members have any comments or suggestions for action? It does seem in this instance that both public opinion and the government accept the case for the disposal of human cadavers using alkaline hydrolysis. Regulations are currently being drafted, so it's whether or not we feel we want to keep the petition open until we see those regulations, or whether we can close the petition content with the fact that both the government and public opinion seems to be in support and regulations are going to be forthcoming. Do I have a preference from the committee? Mr Ewing.
Well, just rereading that exchange, which I think you described as grisly, convener, I did note that you say, I'm happy to say to the petitioner, we will not bury the petition, but we'll make efforts to keep it alive. And given that undertaking, convener, which I remind you, perhaps we should keep it open so that it is not given a premature burial.
Thank you very much for that, Mr Ewing. I can see you have mined the depths of the minutes of the previous meetings in order to resurrect my commitment on that occasion, which is very good of you. So will we agree then to keep the petition open until we see the regulations, which we believe are going to be forthcoming, and perhaps just write to the Scottish Government asking if they can give us an indication as to when they think that might be going to happen? Thank you. Petition number 2086 to recognise the vaccine injured and offer appropriate treatment. This lodged by William Queen, and it calls on the Scottish Parliament to urge the Scottish Government to acknowledge those injured by COVID-19 vaccines and to have the NHS offer appropriate treatment to those who are injured. Last considered on May 29th last, when we agreed to write to the Scottish Government to seek information on informed consent, specialist diagnostic testing and specialist treatment. And the Scottish Government's response states that information on the potential side effects of the COVID-19 vaccine is provided with each appointment letter, which includes links to further detailed information. And the submission highlights that staff at clinics are trained to answer any questions about side effects, and that each patient must give informed consent before receiving a vaccination. I have to say that has been my own personal experience. The Scottish Government submission states that there is currently no specialist diagnostic testing available for the COVID-19 vaccine-related harm. But there are other methods of diagnosis. For example, if a patient has a condition that is known side effect, further tests or clinical assessment could be done to rule it out or to rule out other likely causes. However, there may be nothing definitive to confirm the cause of the condition. The submission reiterates that regardless of how the individual contracted a condition, they would be offered the same treatment then as any other patient. The petitioner's written submission highlights concerns that patients are not being adequately treated for the conditions they are presenting with, resulting in some individuals seeking private treatment. He points to vaccine-induced myocarditis as a condition that can be difficult to diagnose. He also states that he is aware people have been described as over-anxious when seeking support through the NHS, leading them to be hesitant about continuing to seek support, while others have pursued private care and received a diagnosis of heart injury. Again, I believe we may well have the petitioner with us in the gallery in relation to this petition this morning, so good morning and welcome to you. I do think that there continue to be issues of substance here. I think this is a petition we'd want to hold open. Do members have any calls or suggestions for action? Faisal Chowdhury.
I think we should keep this open and write to the Scottish Government to ask whether conditions that could be side effects of COVID-19 vaccination are being monitored to assess whether the conditions are presenting differently for those whose illness may be a result of COVID-19 vaccine.
Are any other suggestions? Mr Ewing.
Yes, I note the petitioner's written submission, recent submission of the 23rd of January, which extends to 2.5 pages of A4, is very closely argued and covers an awful lot of points, which I won't rehearse now, but plainly petitioner has, possibly with others, carried out a great deal of of background work here, and I wonder if the Minister specifically could be asked to respond to the main points raised by the petitioner in that submission, because I think they are, in many cases, points of principle which should be addressed because they may affect many people, as indeed the petitioner suggested was the case in his original petition and comments submitted therewith.
I think that Mr. Chowdhury. Sorry,
can you also write to NHS Scotland, ask them how they are treating COVID-19? Because there is, I had a roundtable and I was told that they're not treated as a patient, or they're not giving priorities, whereas people have reservations about their illness.
Okay.
So do you think we could ask NHS?
We can do that. I think, though, that Mr Ewing is correct. I mean, I think we have got quite a comprehensive series of very specific points that the petitioner has advised in their latest petition, which we could condense into a specific series of questions to put to the Minister and see what response we can obtain. And similarly, write to the NHS, just highlighting the issues in relation to the requests of staff. Are there any other suggestions? Are we content to keep the petition open and to pursue those particular points? We are, and I think in so doing, can we thank the petitioner for the work that they have done in relation to the ongoing underpinning of the petition that was submitted, and we will take forward and seek specific evidence on the very particular points that have been identified in the most recent submission. Okay, thank you. That brings us to the end of item 1. We move to item 2, which is a consideration of new petitions. And as we always do just before consideration of this, because there could be people joining us or watching for the first time to hear how their petition is being treated, in advance of the first consideration, we take 2 actions. One is to contact the Parliament's independent research body, SPICE, to get a briefing on the substance of the issues raised. And the other is to write to the Scottish Government for an initial impression of the issues raised in the petition. And we do both those things, because historically this committee, when it first considered a petition, would then say those were the first 2 things we would do, and all it did was delay consideration. So it allows us to accelerate our consideration of a petition. And the first of those this morning is petition 2130, to make it illegal to remove all the hair from a horse's tail. This is lodged by James A. Mackey, and it calls on the Scottish Parliament to urge the Scottish Government to introduce a ban on the removal of all hair from a horse's tail to leave a bare stump, other than for medical reasons. And as Mr Mackey notes in the background to the petition, the tail is a vital part of a horse's anatomy, serving several functions. The tail assists in temperature regulation, is a mechanism for balance by subtly influencing the alignment of the horse's hind end. It deters pests and is a vital communication centre for relaying messages about the horse's mood, health, energy and locomotion. The SPICE briefing notes that horses are protected animals under the Animal Health and Welfare Scotland Act 2006, which includes general offences such as causing a protected animal unnecessary suffering or carrying out a prohibited procedure on an animal. This Act also permitted Scottish ministers to make codes of practice for protecting animals, with the Welfare of Equidae Code of Practice being published in 2009. However, the code does not include anything specific on tail hair removal. The petitioner and others, such as Animal Concern, suggest that there are alternatives to removing tail hair, such as braiding or bandaging, which keeps the hair out of harm's way and can be undone easily, allowing the tail to function naturally. In response to the petition, the Minister for Agriculture and Connectivity states that the Scottish Government does not support or recommend the complete removal of a horse's tail hair. However, the Government is also of the view that a ban on removal of hair from a horse's tail would be an unnecessary and disproportionate response. They instead suggest that the issue should be addressed in updated equine guidance, and that updated equine guidance is now currently being developed. We've also received a submission from Mr Mackey, responding to the Minister's comments, noting that as guidelines are not enforceable, legislation is in his review required. The submission also includes quotes from a House of Lords debate which took place in 1938, ahead of the tail docking and nicking ban being introduced, with Mr Mackey suggesting that the arguments being made are just as relevant today. Well, the Scottish Government, I think, has given a view on its likely course of action, and I doubt there's much time for primary legislation left in this session. I wonder what colleagues are inclined to suggest. a rush of enthusiasm to identify how we might proceed. Any views, Mr Ewing?
If equine guidance is currently being developed, I wonder if we could ascertain when that will be provided and produced, and allow the petitioner the opportunity to comment once the guidance is produced. I know that it is argued that guidance in itself will be insufficient because it would not outlaw practice which he believes to be injurious. There does seem to be a fair amount of evidence to suggest that, and indeed the Minister talks about injurious ill health side effects. But I think, to be fair to the petitioner, if guidance is going to be produced, then there should be an opportunity for the petitioner, having raised this and all the work that's been done subsequent, to see if the guidance cuts the mustard. If I don't want to start.
Let's not try and find appropriate metaphors.
Here today, gone tomorrow comes to mind. But I better not stray into facetious territory, because I do think, to be fair, the petitioner has raised a point about which he and others feel very strongly. And for that reason, I don't think we should close it yet, but allow it serious consideration.
Okay. Well, since you are keen to make hay with the petition, we will we will keep it open. If colleagues are content with that proposal, and we will specifically, I think, seek to get clarity from the Scottish Government on the timetable for this equine guidance, which is much anticipated, then invite the petitioner to comment. Okay, we now move to petition number 2131 to grant Scottish Rivers, including the River Clyde, the legal right to personhood. And this has been lodged by Professor Louise Welsh and Jude Barber on behalf of the Empire Cafe, and I'm wondering whether our remaining guests in the gallery may in fact be they, and it seems that they might well be. I'm tempted to just remind myself where the Empire Cafe is, because I have a feeling I know, but it's just, but I shan't. Anyhow, the petition calls on the Scottish Parliament to urge the Scottish Government to grant the River Clyde and potentially other rivers in Scotland the legal right to personhood by adopting the Universal Declaration on the Rights of Rivers, appointing a nature director to act as a guardian of the River Clyde with the responsibility for upholding its river rights, to consider whether an alternative mechanism should be established to act for the rights of the river, its inhabitants, human and non-human, and society at large. And we're joined in our consideration of this petition by our former MSP colleague and former member of the committee, so I need to put the former in the wrong place there, former committee member Paul Sweeney. Mr Sweeney is joining us remotely just by way of a change. He must have got fed up coming into the proceedings on a serial ticket basis. So good morning to you, Mr Sweeney. It's always a pleasure to have you with us. As the Spice briefing highlights, granting legal personhood to rivers is part of the wider rights to nature movement, an emerging area of conservation law and practice. And while legal personhood is used for other non-human entities, such as companies, and has been granted to rivers in New Zealand, Bangladesh, Canada, the design of rights nature designation varies markedly. In its response to the petition, the Scottish Government states that it does not support the proposals of this petition, and notes that there would be a need to balance rights of rivers with the rights of existing natural persons and existing non-natural persons. The Scottish Government considers there are already, and I quote, well-developed policy mechanisms in place that balance the interests of nature, society and the economy, including legislation to protect and improve Scotland's water environment. The response also draws our attention to the designation of the Clyde Mission as a national development in the most recent iteration of the National Planning Framework, MPF4. It is for these reasons that the Scottish Government view is that granting rivers legal personhood is unnecessary and would have unpredictable results. Now, we've also received a submission from the petitioners which welcomes the approach being taken in MPF4 in respect of the Clyde Mission. However, they remain of the view that there is insufficient governance and stewardship mechanisms to implement and safeguard the River Clyde and its potential, noting that while the Clyde is central to the broad remit of the Clyde Mission, the river itself is not represented as an entity. And before we view what further action we might take, can I ask Paul Sweeney if there's anything he would like to say to the committee?
Well, Thank you, Convener. It's a pleasure to join you again today. Felt like I had to be close to the Clyde to make this statement to you, so that's why I didn't just come over to Edinburgh today. But I think I was rather disappointed by the government's response to the petitioners, because I feel that, in fact, the points made by the government in rebutting the petitioners' requests was, in fact, the actual position of the petitioners. So I feel they're in violent agreement. It might seem a bit of an esoteric concept, legal personhood for a river, but I think it's exactly what is needed. And indeed, it's been a glaring gap in our policy landscape for some time. I know that the Scottish Government has cited the Clyde Mission as a vehicle for this, and perhaps that's something to consider. I think the fundamental point that I'm in agreement with the petitioners on is that there are insufficient governance and stewardship mechanisms in place to implement and safeguard the River Clyde and its potential, and that whilst they understand, and we all understand, that the River Clyde is central to the Clyde Mission's remit and sits at the centre of the Clyde Corridor, the river itself is actually not fully represented as an entity, and all stakeholders aren't really involved in a formal mechanism. I think that could be an opportunity for further development. We know there's a myriad of private owners who have significant interests in control of the river and its hinterland, and they have no formal obligations to engage, to consult, beyond fairly threadbare planning and statutory obligations. And I think there is a need to improve accountability all round there, and to address those issues. Historically, the river had a far greater degree of oversight. The petitioners cite, for example, the Loch Lomond and Trossachs National Park as a potential benchmark of how you could evolve this. But it's not purely about the nature aspects of the river. It's about all manner of aspects of management of the river, the population, industry, etc. When you consider Glasgow Town Council, which became trustees of the River Clyde in 1770, they initially had management responsibilities for dredging, harbour development. The River Improvement Trust of 1809 added ferries to its remit in 1840. That was then in turn replaced by the Clyde Navigation Trust in 1858, and that had a fairly formal standing. There was 9 representatives of ship owners, harbour ratepayers were represented, the Corporation of Glasgow had 10 representatives, the Chamber of Commerce, the Merchants' House, the Trades House, the County of Lanark Council, and indeed the boroughs of Dumbarton, Clydebank, Renfrew, Govan, Partick were all represented. This was then evolved into the Clyde Port Authority in 1966, which was a trust port, and then the 1991 Ports Act opened the door for Clyde Port Authority to be privatised, and indeed it was subject to a management buyout and then floated on the London Stock Exchange and then acquired by a private group of companies, the Peel Group, in the early part of this century in 2003. So they control privately 450 square miles of land around the river and significant strategic port facilities, but there's no formal mechanism for everyone to be involved in management of that and to consider its wider impacts. So whilst the Clyde Mission's a welcome development in recent years, and it's certainly been led by the Glasgow City Region local authorities and Argyll and Bute Council, and it's been resourced with £1.5 million of investment to set up a strategic master plan, I think there could be further development there. So my real fundamental request to the committee is to consider how we can bring the Clyde Mission in, the relevant local authorities, and discuss how do we develop the accountability mechanisms for the Clyde Mission. How do we actually put it in a more formalised footing? Can there be more representation? Can there be more formalised board meetings? Can there be a wider remit there? And can we build out from the Clyde Mission and try and get back to something like the Clyde Port Authority of old, and actually have a more broader management plan for the river, which feels visible and accountable? And I think that's at the essence what the petitioners are requesting. It's not some sort of esoteric concept. Is actually broadly going back to what we once had, which was very effective in managing the River Clyde and other rivers in Scotland, to have a more broader form of structure of management.
Thank you very much, Mr. Sweeney. That's actually quite a helpful exposition, I think, of some of the issues underpinning the petition that sits before us. Having heard from Mr. Sweeney, do colleagues have any suggestions as to what we might do? Mr. Chowdhury.
Thank you, Convener. In 2019, the High Court of Bangladesh conferred legal personhood upon the Tuareg River by an extension, all rivers in Bangladesh. I mean, in light of that, and in light of what Mr. Sweeney is saying, that I think we should keep this petition open, and I think it would be good to write to the Glasgow City region to seek its view on the action called for the petition, as well as information regarding the work that's being done to deliver the Clyde mission.
Thank you very much, Mr. Chowdhury. Mr. Ewing.
Yes, I'm very grateful to Mr. Sweeney for his most informative introduction and interesting background to the history of the Clyde, and it's got a place in the hearts of many Glaswegians. And I originally hailed from Glasgow, and my grandfather won a medal for swimming the Clyde, and I used to be the cox to my father's team of 4 oarsmen who were called the Senior Argonauts, and they were certainly very senior, and as the cox, I managed to steer them into the riverbank on many occasions. We never needed to be rescued by George Parsonage, who was the riverman and who for 50 years rescued people from the Clyde. So many lives he saved. He said that for every if there were a notch in my oar, for every rescue I carried out, there'd be nae oar. But these irrelevant reflections, personal reflections aside, I just wanted to convey that I think we all have an affection for the River Clyde, and much of the arguments towards the end of what Mr. Sweeney included in his remarks today about how it can better be cherished, appreciated, protected, I think we would all agree with. So I do think that rather than close the petition, we should explore how that could be done. If I could just, without wanting to sound any discordant note, also say that it was in Glasgow 48 years ago that I studied the law of persons, and the river cannot be a person in law, and therefore, whereas I think we can have sympathy with the aims of the petitioner, the means by which they seek to give effect to those aims are ones that I think would not really fit with Scots law, and I pay all respect to other countries that have taken a different view. It might be that some new form of body, the Glasgow Humane Society had a role, Clyde Mission has a role, other bodies have been mentioned, a new charity could be established if it is felt that that is necessary. But I think that would be a more orthodox manner of pursuing aims which perhaps we might all agree are worthy ones.
Thank you. I think that's very nicely rounded and put, because I'm not sure the actual aims of the specific aim of the petition is something we can deliver, but the underlying issues raised by the petition, I think we could pursue in the way that has been suggested this morning. Are colleagues content to proceed on that basis? So we are. So thank you, Mr. Sweeney, for assisting us in coming to that determination. We will keep the petition open. The petitioners in the gallery can be assured of that point, and we will seek to get the information that has been requested from the parties as suggested. Thank you very much. That brings us to the last of our new petitions this morning, petition number 2137, which is the fair regulation for non-medical aesthetic injectors, lodged by Mr. Sculpt. Oh no, Mr. Sculpt Aesthetics Limited. Or Jordan Morrison of Mr. Sculpt Aesthetics Limited. Sorry, the petition calls on the Scottish Parliament to urge the Scottish Government to introduce an aesthetics licensing scheme to ensure that non-medical practitioners meet training and safety standards. And the petition argues that a complete ban on aesthetic injectors risks driving treatments underground where unregulated and untrained individuals could operate without oversight, significantly increasing risks to public safety. The petitioner states that by contrast, regulation would mandate accredited training, ongoing education and adherence to strict safety protocols, ensuring injectors have the necessary knowledge to perform procedures responsibly. The Spice briefing explains that currently the only clinics that are regulated are those where qualified registered health professionals work. These are registered and inspected by NHS Health Improvement Scotland. And a review of the regulation of cosmetic interventions recognised that many procedures are not fully covered by existing regulatory frameworks, thereby allowing anyone to be able to purchase and administer products despite the potential for significant harm. The Scottish Government consulted on the regulation of non-surgical procedures which pierce or penetrate the skin in 2020. The analysis was published in 2022, with the Scottish Government indicating that it may introduce a licensing scheme for all practitioners carrying out this work, But this actually did not then happen. The Scottish Government's response to the petition states that its most recent consultation, which closed on the 14th of February, builds on the 2020 consultation by putting forward more detailed proposals for what further regulation could look like. The response states that the consultation does not propose a ban on non-healthcare professional practitioners from performing injections of Botox or dermal fillers. The proposal is that certain procedures should be undertaken in a premises regulated by Healthcare Improvement Scotland, and that they should be undertaken by a trained practitioner working under the supervision of an appropriate healthcare professional who would be available to prescribe any prescription-only medicines required in the procedure or support in the management of any complications. And the Scottish Government will confirm any plans for legislation required once the consultation is closed and we have analysed the consultation responses. Well, I think we've actually all been aware in the media of one or two kind of quite distressing examples of this issue manifesting itself. So, again, I wonder, excuse me, if colleagues have any suggestions as to how we might proceed. Marie McNair.
With that information, I know that also my colleague Stuart McMillan's done a lot of work in this, but I think we should keep it open and write to the Scottish Government. Sorry, it is open to write to the Scottish Government seeking a timeline for the publication of its consultation analysis and its work to bring forward regulation. An assessment also of how its proposed groupings for procedures will impact aesthetics businesses, and particularly the suggestion that Botox and dermal filler procedures could be restricted to premises regulated by Healthcare Improvement Scotland.
Yep, thank you. I think that's very sensible. Any other suggestions? No, we're content. Members, we are content. Yep. Thank you very much. We'll keep the petition open and proceed on the basis as suggested. And I'm afraid that, for those of you who are enjoying proceedings so much, brings us to the conclusion of our meeting today. The next meeting will take place on the 19th of March, and therefore I now formally close the meeting while thanking everyone for their participation and joining us today.